All right, guys. Good afternoon. Welcome to NDD Medical's webinar that we've titled Proper Spirometry Technique and Coaching with the Clinical Experts. Thank you so much for coming on and joining us for this new webinar series that we're starting. My name is Jamie Burgess, and I'm an RT with NDD.
And I'm Darren Fitzpatrick, and I'm an RT with NDD.
Throughout the training, we are going to have the question and answer chat bar open on the right-hand side of your screen. If you have questions come up at all throughout this training, please type them in there, and we will, at the end of the training, we'll jump on and address those for you guys. Also on the screen, it's talking about the chat bar, and then that there will be a post-webinar email sent. It'll have Darren and I's contact information on it, and we are also recording the entirety of this webinar this afternoon, and so the link to the recording will be there as well. All right, just a couple of a few objectives to get started. These are the main takeaways that we're wanting you guys to have throughout the training. We're going to go through describing the pre-test patient preparation and what that entails. We're going to talk about proper patient positioning. We're going to talk about the spirometry maneuver itself and demonstrate the test. We're going to provide some coaching tips and also review common errors and possible corrections for errors that you might encounter during your spirometry test. A well-trained technician is essential for achieving accurate and precise spirometry results. Achieving optimal results begins actually before the patient is ever even in the office.
So when it comes to preparing your equipment before the patient sits down in your chair, here's a few things that we thought were important to go over. One is make sure that your equipment is working properly. And give your equipment a test run in the beginning and the start of the day to make sure everything's in working order. Check that you have enough supplies, mouthpieces, and nose clips. You want to have accurate height and weight for every patient that comes in, so make sure that you have a scale that's in working order nearby. And also make sure that the chair you'll be using for your patient's testing has no wheels on it.
Right, so all of that can be done to make sure that you're absolutely ready for the patient before they even get there. But once the patient arrives, you'll want to confirm when they had their last inhaled medication. Different providers have different recommendation how soon prior to the test they want them to stop their medication. So just confirm that they followed their provider's instructions, as well as the last time the patient has smoked, if they're a smoker. You'll also want to ask how the patient is feeling on the day of the examination. Examples, you can ask if they've had a recent respiratory infection, such as the flu, pneumonia, severe cold, bronchitis, any of those things within the last 3 weeks. If the answer to any of those questions is yes, you would consider with your provider postponing the test until at least 3 weeks after those symptoms have passed, or maybe even longer if they still have a persistent lingering cough. These illnesses can have a small short-term effect on the small airways, and they can affect your test results. Spirometry should always be performed on well patients who are at their baseline of health. Some other considerations can include recent ear infections or recent surgeries, especially abdominal surgeries. These can cause discomfort for the patient during testing. Lastly, ask the subject if he or she wears dentures. This is something that a lot of times people don't think about. Well-fitting dentures can actually help the patient create a good seal on the mouthpiece. Loose-fitting dentures should be removed for the test just because it can affect that seal on the mouthpiece. Proper positioning for spirometry. This comes up like you see us straightening up. We automatically straighten up in our chairs when we talk about proper positioning. Depending on your facility, the patient can sit or stand for a spirometry test. Put a chair behind standing patients, that non-rolling chair we discussed, just because they might get lightheaded or they might want to sit between trials. If the patient sits, encourage them to sit up straight, and be sure for future testing that you note in your spirometry results whether the patient was sitting or standing, because it can make a difference from test to test, depending on what position they test in. The next thing to talk about is patient clothing. Instruct the patient they can loosen all tight-fitting clothing such as a necktie, tighter pants, belt, bras, girdles. All of these things can inhibit that maximum fast breathing. Another thing to check is chin and neck position. Instruct the patient always to elevate their chin, extend their neck out. You don't want them slunched over and restricting that airflow at all. This position also allows them to get that most forceful exhalation possible. Lastly, we always want to recommend that the patient use nose clips. Show the patient how to use them. Sometimes they'll cheat and put them too high, too low. You want to make sure that the nose clips are on in the right way so that we're preventing air escaping through the nose. We want to make sure that we capture every last bit of air coming out of their lungs as possible. If they're uncomfortable with a nose clip or they're unable to tolerate wearing the nose clips, pinching their nose with their fingers is also acceptable. All right, moving more into the test procedure. Mouthpieces. Always demonstrate for the patient how to properly put the mouthpiece in their mouth. I always recommend showing them this on your own mouthpiece. Explain that you always want your teeth on the top of the mouthpiece with the tongue on the bottom, always making sure that the mouthpiece is never blocked. So.
As you see with Jamie, she has her mouth completely around the mouthpiece, and it's really something you want to check prior to the patient starting testing. What you don't want them to do is the musical instrument look. That doesn't help you. So always make sure that I always ask that patients rest their teeth on that mouthpiece, wrap their lips completely around, and again, make sure that chin position is accurate.
Right. When you first walk into the patient's room, this is a very coachable test. So you want to establish a good rapport from the patient from the time they walk into the office. Always introduce yourself to the patient, explain to them that the test they're going to be doing will be taking measurements to check the health of their lungs. The word test often makes people nervous or uncomfortable. They get that test anxiety that they're not going to have the right answer or that they'll be able to do something that won't make them pass. So just a clear explanation a lot of times is all patients need to ease that anxiety. I always point to the spirometer and just tell them this is what we're going to be using to record the amount of air that you are able to exhale and how quickly he or she, the patient, is able to do it. Exhaling as forcefully and as quickly as possible into a spirometer is called an FVC, or a forced vital capacity maneuver. All right, moving into kind of the coaching part. Again, I know I'll say it a million times throughout the training. This is such a coachable test. For the purposes of this training, I'm going to play the role of the tech, and Darren's going to be the patient for me. So again, I'm just going to kind of role play with Darren from start to finish, kind of what a spirometry test should look like. So my name is Jamie, and I'm an RT, and I'm going to be doing your testing today. Your provider has ordered a spirometry test to assess your lung health, and I'm going to coach you and help you through the entire process. So I'm going to tell Darren, whenever you're ready, I want you to take the deepest breath possible and without hesitation, blow into the spirometer as hard and as fast as possible. I'm going to watch her to make sure she fully inhales, places the mouthpiece using those tips that we just gave you, and that she blasts out the air as hard and as fast as she can. I'm going to instruct her to keep blowing to blast that air out until the device ends the test or until the patient plateaus, meaning she has absolutely no air left in her lungs. You'll want to watch that mouthpiece placement and look for that patient posture at the start and throughout the whole test. So Darren, let's go ahead and do an example. Your nose clips are on. Gonna take good seal, deep breath in, blow it out as hard and as fast as you can. Keep blowing, keep blowing, keep blowing. Go, 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 go. And take it out. Very good job. We want to actively, and forcefully is kind of a strong word, but really you do want to be a forceful coach almost to the subject while they perform this maneuver. You want to emphasize to blast the air out. I know Darren always talks about how she claps, just to really emphasize that fast, immediate blowout of air. Keep blowing, keep blowing. You want to encourage them to make sure that their lungs are completely empty. Studies have actually shown that the more active coaching occurs during the exercise, the more consistent and the more effort that patient is going to give to you. Okay, after each maneuver, absolutely let the patient rest for a couple of minutes until they're ready. A couple of things to point out about maneuvers and trials. As most of you know who do spirometry, for an acceptable test, you do need at least 3 acceptable, reproducible maneuvers. You don't want to do more than 8 attempts unless the patient is able. While those 2 words, acceptable and reproducible, they seem really similar, for the purposes of spirometry, acceptable is defined as the test is free from error, and reproducible is defined as there being without excessive variability. So we want not only acceptable results, but consistent results from test to test to test. Okay, Darren, we're going to do another trial. So let's get your nose clips on. Have her make a good tight seal. Take a deep breath in and blow it out as hard as fast as you can. Watch your posture set up good and straight. Chin up. Keep blowing, keep blowing, keep blowing. Tummy all the way in. And take it out. Very good. Another important thing is to be really animated. Use a lot of body language to emphasize the maneuver. I really do kind of take a deep breath with them and blow, blow, blow out, and I'll kind of push my tummy in, kind of show them how they really, really need to squeeze out every last little bit of air. Demonstrate, I really do kind of take a deep breath in right with the patient. Demonstrate the maneuver right alongside your patient. Always be positive, always be encouraging. You know you're not going to have perfect Darren results every time with your patient, so always stay positive, always stay encouraging to give them just tips on how they can do better on the next trial. One thing to note for those of you guys who use our spirometers, and also I know there's a few of you on the call that use other devices, on INSDZ spirometers, it's important for me to say you can actually start the maneuver 2 different ways. You can perform the maneuver as we described earlier. They can take their deep breath in, make their seal, and then blast out. Or they can actually perform the entire maneuver on the mouthpiece. So making their seal first, then inhaling and forcefully exhaling. Either is completely fine for our devices. Whatever is easiest for the patient. Sometimes that coordination of big breath, seal, blow out is a little bit difficult for some patients. So really whatever works best for you as a technician and the patient so that you are able to get the best test results. Okay, Darren, let's do one more trial. All right. So nose clips are on. Make a good tight seal. Deep breath in, blow it out as hard and as fast as you can. Blow, 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 keep going, keep going. Make sure you're sitting up good and straight. Blow, 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 blow. Tummy all the way in and take it out. Awesome. This barometer, since we did have those 3 good trials, is telling us that the session is complete. We're going to go in and Darren's going to talk a little bit about some common error messages that we kind of get calls a lot as trainers with NDD, some common error messages, some common troubleshooting, just that we hear a lot that we think will help you guys out.
Absolutely. So again, Jamie brought up some troubleshooting and some questions that we get often into the office. And there's 4 that I wanted to go over that we see most common. The first one is when your device says, please blast out longer. And what that means is the patient has not exhaled completely. And we've had those patients that you have them take a deep breath in, they blast out beautifully, and then they take it out of their mouth and say, I'm done, I can't do anymore. We know that they can, and that's where that encouraging and that animated, like, we're going to try one more time, there was still air that was coming out, the device is showing us you still have air to come out. So again, it's really encouraging that patient to take the deepest breath that you can, blast it out as far and as hard as you can until I tell you to stop. Abrupt end of test detected, another really common one. Again, the patients do the similar thing is they take a nice deep breath in, they blast out hard and fast, and they just take it out and just stop it. And we're like, no, you got to keep going. So, and I know sometimes even giving them that this is going to take 6 seconds, sometimes even saying that number makes them a little nervous. So usually we just say, take the deepest breath in you possibly can. I'm going to have you exhale for as long as you can until I tell you to stop. Those would usually help with those abrupt end or blast out longer. A very common one we get is the patient hesitation detected. And what that has to do with is that FEV1, the forced expiratory volume in 1 second. Most patients should be able to get most of their air out in that first second, and that's what we're looking at on the blast. So when you instruct your patient to take a nice deep breath in and blast hard and fast, most of their air should be out in that first second, and we need that measurement. But what happens is they take a nice deep breath in and they hesitate. And we get that do not hesitate, hesitation detected. So it's really important. And I talk to patients and I say, listen, when you take that deep breath in and I tell you to blast out, I need all of your air out in that first second. So really animate, really discuss with them. And sometimes it does help for them to understand what you're looking for. So again, big breath in, hard and fast blast out, so you don't get that hesitation detected. And again, another one is please blow out faster. Your peak flow is delayed. Similar, big breath in, and the patient just doesn't hit that peak flow, doesn't blast out fast enough in the beginning of the test. So those are some of our most common ones. Again, it's really sometimes just explaining to the patients, you got to punch that air out. Jamie said, if you guys have had me, I know some of my accounts are on here that I've trained, but big breath in and go. I clap, wake them up, get that air punched out so you don't get those hesitations. Other big issues can be the mouthpiece placement. Again, we went over that, the trumpet, dentures being in the way, things like that to really make sure that, the seal is done correctly. And of course, nose clips. I know sometimes it's hard to get patients to do it, but it really does help when you have a patient wear these. And also, when we encourage patients to take a deep breath in, we've also have those patients, we say, hey, time to take a deep breath in, and they do a and but we really want to encourage them, take the biggest deep breath, and I say, like, you're going to go underwater for a really long time and blast it out as hard as fast as you can. So really encouraging that patient to, really take that deep breath in, and that's when it's really important for us to watch our patients to make sure they're able to hit their maximal inspiration. And obviously blasting out as hard as fast as they can, not in short little, I call it Lamaze breathing, but we all have those patients too that take a deep breath in and it's short little breaths. So again, Jamie had described that you having your own mouthpiece is really instrumental when you're talking to your patients or showing them what you want. And it helps save you time and that patient time from testing when you just take a deep breath in and show them exactly what you're looking for. It really does help. So those are some of the tips that we found from training. But this is going to be your best friend, I think.
Oh yeah, keep it in your pocket.
Yep. And so what we'll do is we'll go over a couple more slides that we had put together in regard to go over the objectives again of this call and some key takeaways. So what we really wanted to on this, our first WebEx that we've done, is understand how to prepare a patient for a test, because sometimes that is the most difficult because we know you guys are so busy. But really taking the time, like Jamie said, to explain it to the patient, tell them why they're having this done, and really be that animated and helpful technician to help them have success in testing. Coaching is vital in getting optimal results. Be positive. Encourage them, show them how the test should be done. And understand common error messages and how to coach the patient and be successful. And I'm sure there's other error messages, and you guys are more than welcome to message us and let us know so we can help answer. But these are the four I went over were our top ones.
I'm going to go ahead and hop down to that chat bar. It doesn't look like we've had any questions come up during the presentation. So I know a few of you guys hopped on the call a minute or two in. There on the right-hand side of your screen, there should be a question and answer chat bar. If there are any questions you guys that have come up throughout the training, absolutely take a second to type those out and we can get those answered for you guys. What is acceptability criteria?
So on this
good question.
That is a great question. And it's probably going to be one of our next trainings that we do is to go over the acceptability and reproducibility, because as we know, some of the guidelines have just recently changed. But you're really looking for that 150 milliliter between the two acceptable tests or doing 3 tests. But that's something that we definitely are going to cover in another WebEx. This one was to go over more of just how to get the patient to properly do the spirometry test.
Right.
But we can definitely, is it Jose? Jose, we can definitely send you an email afterwards too, because I know we have.
Yep. Absolutely. Anybody else have any questions? Let's see, we'll watch it here for just a second. I'm going to go ahead and just pop up our contact information here. Again, I know that I mentioned it at the start, but you will get an email from NDD just thanking you for coming to the webinar. This content, the PowerPoint content, will be included in that, and also a recording of the training. So if you have other staff, other team members who weren't able to jump on, this is something that you can forward to those offices or to those teammates, just so that they have as a reference. We really appreciate you guys joining us this afternoon. Before I hop off of here, I'm just going to make sure that there's been no other questions pop up.
And again, we will,
one more. Okay, I use the Pro and often get the error message during SVC. can't perform in blue or unable to detect steady tide volume.
So, and who was that from? Sorry.
Oh goodness, hang on, let me scroll back up here. Tracy.
Hey, Tracy. So, yes, with the slow vital capacity, that is also, we have to get a baseline or a steady tidal breathing. And so the best thing to do is, obviously, I'm sure you're using nose clips, but that's one of the big ones. But the other thing is, it's supposed to keep the tidal volume, you want to keep in between lower than 2 liters. So sometimes we get those patients on there that are doing these really big tidal breaths, and that will sometimes trigger to say that they cannot get a consistent tidal breath. So that's one of the big things with SVC. And the other part of the question was hold on, Tracy, sorry. Our little screen is little, so yeah, I'm trying to read the questions. Cannot perform. I'll send you an email too, Tracy, just to make sure you have the most up-to-date software that's been loaded. I know we've fixed a couple of things that have taken out that problem. It says cannot perform. So I'll shoot you an email just to confirm that we have the correct software on your device. But again, the nose clips are a huge help, and really making sure that patient, when I instruct someone to do slow vital capacity, just like you're sitting in a chair, and sometimes it's just,
I'll even tell them, keep it between the 1 and the 2.
Yeah,
keep it between the 1 and the 2.
So see, hopefully that will help. But I'll definitely send you an email, Tracy.
Yeah, absolutely.
I think there was a couple more. Guys, our screen, if you could see how little it is for our questions.
Oh, she says thanks. Okay,
there's
awesome.
More, I think.
It was her saying who she was.
Okay.
Was Tracy saying it's me?
Yes. Oh, yes.
That range may help also. It does for me. I mean, I'm such a visual person. If I can see to keep it, between X and Y, I do a lot better, because the machine doesn't care how long they tidal breathe. It could be 3 breaths or 15. It's looking for that absolute steady, consistent tidal breathing.
And just sometimes walking them through it in and out and in. And, we're all in the Midwest. I know there's some big, tall guys that take these really big tidal breaths, but we really want to emphasize, I want you to breathe like you're sitting in a chair. Yeah. So as quiet and normal as you can.
Little breaths.
A couple more, I think.
She said,
she's laughing at us.
That's okay. You can laugh at us. It's fine.
Yeah. And like I said, and Jose too, if you're still on here, I think the next one we'll be doing is really talking about the acceptability, the reproducibility. We didn't do it on this one because spirometry guidelines are changing again. So we just wanted to make sure, and most of our calls is that we get from physicians or from techs or just struggling really getting that patient to understand what they're looking for. So that was why we chose to do this first. Right. So, but we're always there to help you with any more questions.
Yeah, absolutely. And of course, I'm sure things will pop into your brain once we hop off of here. Again, our email will be at the end of the slide here. I'll go ahead and throw that slide back up. But then also you will be getting that follow-up email from NDD. It's just the website, but you'll be getting an email from NDD with both of our contact information. So if anything comes up, you need to share the recording, just keep an eye out for that email and we'll be able to get it for you guys. I just wanted to say, when you log off of the webinar, there is a short survey. I promise it's short, a very short survey, just asking different questions about the webinar, how you guys, if you think you can implement it in your practices, just how, our knowledge as practitioners, we're just wanting some feedback, because this is hopefully the first of several different webinar series that we're going to be able to provide our customers. So your feedback is just, we'd greatly appreciate it. So take a minute and fill out the survey for us, and we look forward to seeing you guys next time. Great.
Thank you.
All right. Thank you. Have a great afternoon.